research group has been developing PET imaging methodology to address the smoldering inflammation in MS. And you're probably aware that the smoldering inflammation is particularly relevant for progressive MS pathology. And progressive MS is an area where there's really a great unmet need in terms of treatments. And we're hoping that this PET imaging will help in future drug development for progressive MS. So we did this study using natalizumab, where we treated progressive MS patients with natalizumab for 1 year. And we performed TSPO-PET imaging at baseline and 1 year later. And we were especially interested how natalizumab impacts the microglial activation at the edge of chronic active lesions. So these are chronic lesions that have increased microglial activation at the lesion edge. And this lesion type is considered particularly harmful in terms of MS progression. And we developed a new method where we can actually quantitate the number of active voxels. So voxels at the lesion edge that have very high radioligand binding when we perform the PET analysis. So we could actually quantitate the amount of these active voxels at baseline and then at the end of the study. And we could show that in the natalizumab-treated cohort, the number and the proportion of the active voxels at the lesion edge was reduced significantly when compared to an untreated control group. So actually in this untreated cohort, the number of the voxels even increased a little bit. So this was done in a very small cohort of patients, so only 10 patients per group. And so I think one significance of this study is that we can use the results to plan new future studies with other compounds that target the microglial cell activation. And we can, based on our power calculations, for example, on this study, and actually this is what we are doing at the moment. We are preparing for another study with a compound that penetrates the central nervous system, and then we will use this similar methodology to address the efficacy of the treatment.